Hello, and welcome to another episode of 50 Shades of Gray Hair. We're so glad you're here. I have a very special guest. She has been my guest in the past, and many people have greatly enjoyed her talk about health and wellness. I think the last show we did was on hormones. Her name is Valerie Sayre. She is owner and founder and president, and whatever else you want to be, Valerie. Nutrition, connection, balance. And I'm going to let her describe all the initials after her name.
Oh, well, thank you, Yvonne. It's so nice to be back here. I love educating. I feel so lucky and gratitude towards anybody that just wants to flourish and be happier because it affects all of us. So that's wonderful. So I'm a registered and licensed dietitian nutritionist. I did an undergraduate degree at Florida State in food science, and then I did a medical internship at the Cleveland Clinic for a year. And then, and then you take a test and then you become a national registered dietitian. Since that time, I've added on many things. I used to have a pharmacy technician license. I ran a compounding pharmacy for many years. I gave that up about 2 years ago, my license. I just didn't use it anymore. But it was very helpful to understand how prescription medications work, know what goes on in pharmacies, and have that background because all of us
Yes.
sometimes might need medications and they can be life-saving. So it's good to know the nutritional, it's good to know the supplemental, but it's also good to know the pharmaceutical because we're all going to probably need something someday.
The
Yeah,
basics,
that's
for
right.
sure.
And
For
yeah, and
sure.
then I also have advanced medical exercise specialty, which means I can train people with advanced medical issues. I don't personally train people anymore. I'm extremely passionate about exercise. I've done bodybuilding shows, I've done
Oh,
marathons,
I
I've
did
worked
not
with
know that.
yes, I've worked with a lot of professional athletes. My husband was a decathlete, fifth in the world. So all our kids are athletes. We're very active, and that's for sure.
Yes.
But
Yeah.
it helps me still, like if I'm working with somebody and they are having a medical problem and maybe their trainer, their physical therapist, or just they're at the gym and they don't know what to do, at least I can guide them or make sure they get the right guidance,
Perfect.
for the
Perfect.
hands-on. Yeah. And
I
then
get so confused with all those machines. I
it's a
need
lot.
someone to show me how to use them,
Yes.
and they've become so much more advanced
Yes, they
that,
have. They
yeah, so
have.
I
Yeah,
definitely
but
need
once you learn
help.
the basics, that's always the most important, and always the most important is doing it. So that's
It's
even
just
more
getting
important.
there. That's,
That's right.
that's
That's right. That's right. So, and then
for
I've also
sure.
been a Reiki master for over 30 years, which is just a form of energy medicine that has been used in multiple medical, different types of facilities, including the Cleveland Clinic and medical facilities to help people
Right.
through pain, nausea, different types of things. So, that's enough of my background for people to at least know.
You've got an awful lot. Just quickly, because my sister even asked me what a Reiki master was.
Oh, sure.
How, just tell me briefly what you do when
Sure.
you have a client.
Yeah, basically when you do Reiki and mainly I teach it to people and that was one of the reasons that I got involved. There were two reasons. So number one is that there is lots of medical research on nausea, pain, cancer, different things like that. And then it's also something someone can learn and do on themselves. Most healing techniques require you to always go someone like a chiropractor or a massage or physical therapist or even cranial sacral. But Reiki you can learn yourself and there's certain hand positions that affect how energy flows through your body that can help balance things out, whether it's pain, nausea, anxiety, that type of thing. So it's a wonderful tool where you can lay your hands lightly on people, clothed, but you can also put it above someone. So if someone has a wound, like when my dad was alive, he had a big wound from diabetes. I would do when I would see him Reiki above the wound because you don't touch a wound. And that still could help with the healing process, even whether it's traditional or integrative functional medicine types of healing. Yeah.
Now, I know that one of the things I had told you I wanted to talk about, which is on everybody's mind
Yes.
these
Yes.
days, is GLPs, weight
Yep.
loss.
Yep.
And I'm one of those who's still trying to lose the same 10 pounds. And I might have
Uh-huh.
said this in our last interview
Yes.
that I've been trying to lose for 20 years. So,
Yes. Yeah.
so
Yeah.
help.
Okay, so let's start with the medical part first with the GLP, which is a
Yes.
glucagon-like peptide. And again, you
Oh,
don't have to know what all those mean, but I know, but it is helpful because when you do learn little things, you start to understand how they work. And then you can ask better questions. So they particularly are given right now mainly through injections. There is a new pill, I think just a few weeks ago, that might be coming out once it gets approved, but it wasn't a study that might be able to take in place of an injection. And typically the injections are once a week. And what those injections can do, a GLP glucagon-like peptide, is they can actually help with appetite regulation and they can help with
Correction.
metabolic issues. Yeah. Metabolic issues mean that you feel, you can have things like better insulin, better hemoglobin A1C, pre-diabetes
Okay.
numbers, things like that. And I'd say the biggest thing as a registered dietitian that I see working with someone, for 30 years working with clients is the biggest thing is some people are very wired where they're always thinking about food. Even when they're a professional, even when they're a happy person, there is genetic differences. And the GLPs, probably, in my opinion, what helps the most is I call it food noise. It helps where people are not obsessed with food all the time. So those are some of the positives. There are two kinds. And of course, there's a lot more, but I'll try to keep it simple because I
There's
think
tons of
there
different
is, but
brands.
I
Yeah.
think people are very confused. And so it's really helpful to know
Yes.
there's really kind of two categories. There's a semi-glutide, which are like when you hear advertisements, they're like Ozempic and Wegovy. And then
Wegovy.
there's tirzepatide, and that is a
Correct.
particular GLP, but it has Mounjaro and Zepbound. And those are more, they have an advanced thing besides a GLP called a GIP. And that means that it actually helps a little bit more with weight, but especially with glucose, insulin, hemoglobin A1C. So some people do well on one, some people do better on another. And I think it's important to always keep that in mind that you do have to dose it, be talking to your physician and your health professional, and then figuring out if it's right for you. Now, do you want to ask me other questions or do you want me to keep talking about it? I know you had a lot of questions about it, which is wonderful.
More importantly, because I have several friends who are on these and
Yes,
I've actually considered, but actually
sure.
they would not let me go on it because of my
Uh-huh.
age.
Uh-huh.
So I think there's a
Yes,
certain age cutoff, 75 or
there
80.
is.
Right,
Yes,
so I
yes,
can't go on any of those.
yes,
But
yeah,
people don't want to do the injections, they'd rather do the pills, and there's so
yes,
many of the
yeah,
different pills. Let's talk side effects. That's what
yeah,
I'm more concerned
yeah.
about, is side effects from any of them.
Yeah, I think that's really important. And that's something that we all get excited about results, but we have to know for every positive there can be a negative. So there's three or four different areas that I think are really important. The ones that people most talk about are things like nausea, you could have vomiting, you could have some constipation or diarrhea, you could
Correct.
also feel overly tired. And so that
Um,
is something that does happen. And I always say, I always ask a lot about that because I'd say that's still the number one issue that most people have is they're tired all the time.
okay.
So you do want to pay attention to those. And if you have those symptoms, sometimes they go away. Sometimes you need to have smaller doses and go slower. So I think
Adjust, have
that
your
is
doctor
correct.
adjust the
Yes.
dosage.
Yeah. And if some of that doesn't go away, then you really need to find out, could you do a different one or could you take another route? So those are the ones most people know about. I think the ones that people don't realize can be a little more serious, like gallbladder issues, thyroid
Yes, I've
issues
heard
and
that.
thyroid cancer. Yeah. Yeah.
Yes.
Pancreatic changes because it's changing how insulin is released in the body.
Oh, right.
So that's kind of
We
the
don't
second
realize, I don't
category.
think we realize what
Yeah,
changes our bodies go through when we're taking these drugs, because
absolutely.
they're pretty potent, they're big guns. So
They
you
they
do have
are.
to be very cautious. And then there's the issue of possibly when
Mhm.
you do go off of it, and I understand you can't
Yes,
stay on them too long, then you
correct.
can gain the weight back. So you've got to be very
Yes.
cautious.
Yes, and I think there's two parts to that, and that's the other two parts I want to talk about that are helpful, whether you can go on one and want to go on one, or like yourself, are not in that group that's a good candidate, and what
Right.
could you do to lose that extra 10 pounds? So if we still talk about the injections first, the other thing is that the doctor should be doing basic blood work, not once a year, but probably every 3 to 4 months, your thyroid and checking your liver, your kidneys, and pancreas. So that's important. The second thing is that the other big risk besides the weight gain is the bones and the muscle loss. So,
Oh, I
and
forgot.
that's where I come in. And I have to tell you that even my patient load, who's very proactive, they often just think that's not going to happen to me. I don't know why people think that, but even very educated people very proactive with their health, and I have seen that every single person on it 6 months to a year that has not added strength training 2 to 3 times a week, 20 to 60 minutes. They have not kept their protein level high, 30 to 50 grams per meal, 3 to 4 times a day, and that don't keep their fiber and hydration have all developed full osteoporosis,
Wow.
or they have less muscle than they did before. So when they go off, their metabolism is slower. And we certainly don't want you to go off and not be able to eat food. We have to eat food. That's
Right.
our fuel. And then it also can affect some other things like essential fatty acids and so on, because if appetite gets so low, then again, you get out of bad into some bad habits. And so if you do choose those things, that's important. And I think the other part is that when you get off, wean off slowly, but you've got to keep the good habits, eating 3 to 4 meals, not eating 5, 6, 8 times a day. I really teach people you've got to have the high protein and you've got to have that 25, 35 grams of protein to stay full. So you're used to that feeling that you don't feel hungry all the time. So when I've had patients that have followed those protocols, and sometimes a pre and probiotic. And that was wonderful that I know that's one of the questions you're going to ask me about, because that's part of weight loss, detoxification, metabolic issues. But it's also, if you go on an injection or you go off of it, you want your GI tract to be healthy. So that pre and probiotics can be very helpful also. So when you're thinking about yourself, because maybe someone like you is in your age group or they don't want to do a medication, that's what I have them do first. But you've got to also watch calories. When someone has 10 pounds extra on them and they really are exercising, not doing too much, you want to keep a food diary, cut down on your calories, and get more protein first, eat vegetables second, and carbohydrates last. I've never had a person, knock on wood, not be able to lose that last 10 pounds. I didn't say it was easy,
I
but
know it's not easy,
I didn't say
but
it was
I
easy,
think
but you
when we
could do
all
it.
exactly when
Yeah.
we are all looking for these quick weight loss
Yes.
fixes,
Yes.
we don't look at the whole picture like you just explained. And thank you so much, because I
Of
know a lot of my
course.
friends, when I share this, are going to be very appreciative because they don't look at that.
Sure.
We're like focused. I just want to lose weight. I just want to lose
I
weight.
know. I
And
know.
then you lose it, and then you forget about you're losing muscle loss, you're losing this,
Yes.
et cetera, et
Yes.
cetera. So
Yes.
yeah, so many things are surrounding that. It's not a quick fix because
No.
it takes time.
No.
It
And
takes
and
time.
I and I think the why it's one of the first medication classes that I have been on board with is
Mhm.
because I have seen people that work really hard and they're still 40 or 50 pounds overweight. I
Really?
mean, they really do work hard and they need
Yes,
something to help. And a lot of times when you open that door to change, you can keep those changes and healthy habits going.
that's right. Going forward.
It is, yes.
Absolutely.
Yes.
You mentioned gut health and
Yes.
prebiotics and probiotics.
Yeah.
Let's talk a little bit about that. I am one
Sure.
who has major issues with gut from time to time.
Okay.
I
Okay.
think I've told you in the past that I had 12 inches of my colon removed. So I had
Yes,
a,
yes.
now I'm a semicolon.
That's a good one.
You're supposed to laugh there,
That
Valerie.
is good. I'm laughing. I like a good sense of humor, so that's good. That's better than saying, "Oh my gosh, I'm missing part of my colon," right?
Exactly,
There you
exactly.
go. Of
Anyway, yeah, so I have to be very cautious
course you do.
bouts of diverticulitis, and they're
Yeah,
not nearly what they used to be. I get one maybe once or twice a year now,
sure,
but still
sure.
have to be cautious. But how do
Yes.
probiotics and prebiotics help the gut?
Yeah. So first of all, prebiotics are actually what feed the microflora. So, and they're in things that a lot of people don't know. They're things like that are unusual foods too. Now, oats are probably one of the ones that most people know about. But of course, I teach my patients you don't want to overeat oats because you also don't want to increase your blood sugar. So you want to be careful when we're talking
Oh,
about carbohydrates. The older we get, we want to be careful. But prebiotics are a soluble fiber, and we didn't really talk about fiber yet. So let me just say a soluble fiber dissolves in water to form like a gel. That helps form stool. That helps bring out toxins. That helps things move through the digestive tract.
okay,
And especially like yours, when it's shorter, you have to get things done
exactly.
more efficiently, or
You
else you
lose the
can
peristalsis,
that's right. That's right. So
right?
you can get more diarrhea or you can get more pain, you can get more gas, you can have a lot of different things. So there's soluble fiber, and a prebiotic is a soluble fiber. So it's a gel-like substance, and it's in like fruits, in the skin of fruits and organic flax and things like oats and beans. So those kind of things. And then
Okay,
there's insoluble. Insoluble does not dissolve in water, but it adds bulk to the stool. And that is what's in things like the seeds on fruits and seeds and nuts, the skin on fruits and vegetables, the outside of the baked potato skin, that kind of thing, certain whole grains. So we have
Okay.
soluble and insoluble, and then a prebiotic is a soluble fiber, and it helps feed the gut wall. And it's things like garlic and onions and asparagus and chicory root and oats. And it's funny because it's most of the time as we get older, we just can't get enough of that. I often recommend a probiotic and a prebiotic. Or if someone doesn't want to do both, then I'll say, okay, are you open to eating one or three of these foods every single day?
Okay.
Because you want your gut to build them up, and you also want the mucosal lining that gets assaulted from age, from shortening of any kind of digestive tract, a virus, a lot of different things,
So many
antibiotics,
things. So
so
many
many
things.
things. Because
For
we all have
sure.
to eat. We all have to go
Yes.
through the
Yes,
digestive
yes, yes.
tract. So one of those things that's so helpful is that when you get that prebiotic feeding the microbiome and you get enough fiber, then things start to move better. And then hopefully diverticulitis, inflammation of the colon, or more diarrhea, constipation happens less and less. And so
Okay.
I think the hard part, Yvonne, about probiotics is there's so many kinds.
There
And
are. You go to the store and there's a
I
hundred.
know, I know. And
And
that
we're being barraged online with various
I
products.
know. And I
Yeah.
think it is hard. And that's where hopefully you can see someone like me, or you can even go to our website and get free information of handouts and things, or you can get someone, doesn't matter if it's me or someone that knows in that area what to do, because they should ask you some questions. Do you have any GI issues? Have you had a virus lately? Are more constipated, more diarrhea? Do you have 1 to 3 stools a day? When we know those things, I think I have 1, 2, 3. I have 11 probiotics in my office that I could tell you
Wow.
which one might be the best one for you. And let's
Okay.
say that it's not effective after 2 to 6 months, then I know what class you still need because I know what's going on, like in your case. So then we
Yeah.
say, okay, well, this one, it's not that it didn't work for you. Let's try another
Okay.
one that's similar, but still works on the symptoms and your medical background. And that's what can be really helpful. Okay.
Okay, so it can be confusing because there's not one size fits all,
That is
is what you're
correct.
saying. So they have
Yes.
to be analyzed, they have to, and then
Yeah.
do you do blood work with this?
No, you don't have to do blood work. Blood work is not
Okay.
very helpful for figuring that
Mhm.
out. If there's a lot of issues, some of the things that's helpful are actually a urine test. We call it an oat test, organic oat test. And what
Okay.
that is, an organic acid test looks at 76 markers. And there are multiple yeasts, bacterias, fungus that we all have, but they should be in
Yeah.
a certain amount. If they're too low or too high, they actually cause digestive issues, bloating, gas, diarrhea. So if we
Yeah.
know those things, and it's an easy AM urine sample. So that's one. You can do a blood test that is for candida, but it doesn't show very well if you have systemic or small amounts. Like if you have high amount of yeast, let's say in the vagina or the mouth, you can
Right.
see white on your tongue, or
Right.
sometimes nursing mothers, the baby and the mom gets it, then you can see a white coating. Well, then we can say which probiotic to go on. But
Okay.
but typically when you look at blood, it's not very sensitive. So a lot of people are missed. They're like, I know it shows I don't have this, but I have constant diarrhea, or I have
Exactly.
gas, or my
Yeah. So
stomach
what is it?
bloats. Yeah. So, and then too, if people don't want to test, then they can try different probiotics based on their symptoms. And,
Hmm.
but you can't change every month. That's the thing. You do have to give it some time unless
Okay.
someone's having something brand new. Let's say that I was sick and all of a sudden I had to be on an antibiotic, I had strep throat, and I got diarrhea afterwards. Well,
Hmm.
that's different. I can tell you exactly what probiotic, do it for 10 to 14 days. It should get better. If it
Okay.
doesn't, then we go to the next step. And that's all you
Okay.
have to do. So
Gotcha.
sometimes it doesn't have to be as hard as we think.
We look too hard. Now,
Yeah.
let me ask you this, the urine test,
Uh-huh.
you can do that? Can we send, I don't know if you can send it, we have to do that at a local lab?
Yeah, yeah. So a lot, it's one that's not done very often. Like our office offers it, And let's say, I know I have patients all over the world, so it doesn't matter where you live, but let's just
Right.
say that you said, well, I'm really curious about that. I want that test. Well, then
Yes.
you would just call our office or go to our website, you'd order it, and then kit comes to your house. And the organic acid test is super easy. It's just an AM urine, the first urine of the morning when you wake up. So you don't want to eat or drink. If you wake up 3 in the morning to pee, you don't collect that, the first urine. And then it's sent with a postage paid mailer that comes in the box right to the lab. Then the lab
Okay.
send us the results, then we analyze it and give you an exact recommendation. So it's not just what the lab, like what it says you have. You want someone that knows how to read it and tells you what to do about it, like which
For
probiotic.
sure.
Do
For
you
sure.
need more fiber? Should you have a probiotic? Because not everyone needs those things. It depends.
You said it covers like 76 different.
76 different markers, and half of them are
Okay.
all around the gut. The other ones are
I like that.
nutrients.
I would be interested in that for
Yeah,
sure.
yeah, yeah. Some of the other things in that show nutrients and some neurotransmitters because when people have digestive issues, they often don't absorb nutrients very well. And they
Mhm.
can develop some nutrient deficiencies that will not show up in a blood test till you're already medically deficient.
Oh,
So
okay.
that's the problem, because we eat small
Yeah,
amounts, but medical deficiencies often don't show up until you have a disease or they're so deficient,
exactly. And then it's
you
too
know?
late or yes.
Yes, yeah,
I want to mention to you, I just recently, as you know, I work for Northeast Ohio Thrive magazine, and we
yes.
do these fabulous boomer bash events. And we did one recently, and
Uh-huh,
I think it's Gardent was there and I don't know if you're familiar with Gardent, they're a national company.
uh-huh,
They do testing.
yeah,
They were there and they were doing blood testing if you chose to have it
sure.
for colon cancer. So
Uh-huh,
I
yeah,
did choose to have it. I'm waiting for
uh-huh,
the results to come back.
yes,
But one of the reasons I decided to go that way is at my age, I really was reluctant to get another colonoscopy
yes, yes,
because there's a greater risk of tearing as you said, the
yeah,
stomach lining changes as you
right,
get older.
yeah.
So do you know anything at all about those
I do that,
tests?
yeah, and I don't know that particular company, so I'm not for any company, just so you
Right,
know,
of course. Yeah, it just happened to be the
but
one I used. Yeah.
yeah, but when I go every year to my annual visit with my doctor, I ask for the Cologuard. Cologuard is
I've
one
had
that,
that before too.
yeah,
Yes.
that's
Yeah.
also one you can get where you test the stool. And then
Right.
if it would show a positive concern, then they recommend you get a colonoscopy. But it's much less invasive. That one is approved through insurance, and a doctor can order it. And so that's what when I've looked at the data, that's what I am still most comfortable with for if someone doesn't want to do a colonoscopy. Unfortunately, I don't know enough about the other company. I'm sorry, I can't give you an
No,
opinion
no,
there.
no, that's okay. I
Yeah,
mean, just the test itself, I was curious if you were familiar with
sure.
it, that you
Yeah,
can actually do a blood test for
yeah.
that kind of thing. So we talked about gut health, we talked about weight loss. What else would you like to share? We
Well,
don't
I
the
think,
vaccines, but
yeah. Well, I think let's go back first to why gut health matters. We didn't really talk about that. We talked about symptoms, with bloating, gas, diverticulitis, inflammatory bowel issue, Crohn's, all these things that people know. But I
right.
don't think what they realize is gut health is the actual producer and regulator of 70% of your immune system. So that's important. It's part of metabolism. It's part of nutrient absorption. It's actually part of insulin sensitivity. So, again, how you break down carbohydrates for diabetes and again, weight loss. It is part of hormone regulation. It's actually produces 90 to 95% of all your neurotransmitters. Now, neurotransmitters are a big word. So sometimes people
You're
know the
talking about the
words
neurotransmitters in the brain?
the brain, but the brain only makes
Right.
about 5 to 10%. Almost all of them are made in the gut, including serotonin,
I never
dopamine.
realized that.
People do not know that. It is one of our biggest referrals we get from psychologists, from trauma specialists, is when people have anxiety, depression, it's mainly from the gut. It's not usually from the brain.
That's
Yes,
interesting.
it is the most important thing that I'd say most people don't know. And so when there's
Yes.
depression, anxiety, even like histamine reactions, inflammatory reactions, those are all made in the gut. So
Yeah.
those are also best tested by urine. So that is
Okay.
fascinating. And what happens is that all of those things affect not just that immune system, but how you break down fatty acids. And those things affect the cardiovascular health. And people are always worried about how they look or cancer, but cardiovascular risk is the biggest cause
Health.
of death still today for all of us. So
Yeah.
it's so important. And brain, I know we're going to talk about brain, but I'm going to throw in there that the gut is what actually also affects brain fog, Parkinson's. I can measure different markers from the gut that can indicate if Parkinson's is a bigger risk or what you should do about it, if whether it's a higher risk or not.
Amazing.
It's
Amazing.
so important. So I can't tell you when we talk about gut health, it is much more than a virus or a stomach ache or if you have a section removed. It is absolutely vital to
The
every
whole
single part
body,
of your body.
the whole
Yeah,
body and mind. Yeah. Thank
absolutely.
you for sharing that. Because when I had my radio show many, many years ago, a therapy call and talk show,
Yes,
and we often talked about the neurotransmitters, the
yes,
dopamine, the
yes,
enkephalins, all of that.
yes,
So yeah, that's
yeah,
very, very,
yeah.
I never realized the correlation between the
It's
two.
it regulates the nervous system. Even people that say they have ADD, ADHD, or they
Yes,
feel nervous or overstimulated nervous system, that's all related 90 to 95% from the gut. They're not in the brain. There's a small amount, but it's mainly in the gut.
amazing,
So it's
amazing.
amazing. I know.
And as we always say, we these days we live in a Prozac society, not just
Yeah.
Prozac, but people are
Yeah.
on all kinds of. And if you need to be on it, that's fine.
That's
That's
right.
okay.
That's right.
But you need to also look at the rest of your health,
You
as you
do.
said, the
You
gut
do.
health, the heart health,
Yes.
everything
Yes.
together. What else would you like to share with our
Well, I think the other thing
listeners?
that kind of leads into what you just said that's so helpful for people again is that's where we both are love to educate and be helpful to people is that's why I became a registered dietitian first. Because you're like, well, how does that have to do with metabolic issues and all the other things you test? Because we're all going to eat. And food is what
We have
directly
to eat.
that's right. It's what affects our brain. That's what affects our gut health. That's what affects our mental health. And we a lot of times we just think about how we look or what we weigh, but it
Right.
is what sets us up for those things. So if we kind of go back to the GLP that we were talking about, where I said, okay, if you really want to lose weight with or without that, you've got to track calories. You have to have more protein. And then you want to eat protein first, then vegetables, then fruit, then other carbohydrates. And then also, again, exercise, especially weight training. But what we didn't talk about was that every one of those neurotransmitters, whether we're talking about depression, anxiety, dementia, Alzheimer's, Parkinson's, are all made of protein again. So what happens as we get older, and when I'm talking 50s and older, is we tend to eat less and less protein, more and more carbohydrates, more and more alcohol, even if we're not overweight. And that actually increases your risk of all of the conditions you want to avoid with aging. So
And
that's why
especially sweets. You didn't mention sweets, but
that's right. That's right.
and it's
Sweets are the
sweet.
last one. I know. But that the thing is, if you eat more protein first and you have good nourishment, even when you love sweets, you will eat less
Okay.
because your protein has a higher satiety, you're full longer. You have
Right.
less blood sugar fluctuations. Blood sugar fluctuations cause more cravings, especially for any
Mhm.
kind of sugar or carbohydrates, bread, cereal, rice, pasta, desserts. And
Mhm.
so again, food really matters. And that's where, like, even when we talked about, like you mentioned about talking about hacks and things, I'm all for that. But if you aren't doing the foundational things first, the exercise, the protein, the 25 to 35 grams of fiber, those hacks are 1% of your 1.1
Right.
0.11 of percent of your health.
Yes.
And I know they're fun and they're more easy to talk about, but they aren't what gets you superior mental, physical, or body health.
We look
So
for the quickest fix. I think
I
we
know,
all look for a Band-Aid.
I
We
know,
don't want to have to do the work. Just give
right.
me something. Just give me a pill. Just give me a shot. Let me.
I know, I know. And that reminds me of something, another question you'd asked me that was really a great question too, as you said, if someone doesn't want to do the GLP and they need help besides diet and exercise, there is one called CaloCurb. CaloCurb
Oh,
was
yes, I
studied
read
by
your newsletter.
yeah. CaloCurb was actually commissioned by the government in New Zealand, I think 10 years ago. Don't quote me on the years, but quite a while ago. And it's
Mhm.
been out for quite a few years there. When I was traveling New Zealand and Australia a year and a half ago, I actually got some there because I was very curious because the research showed it's very similar to a GLP and it's a pill form you can swallow, and you do not have to
Right.
have a prescription. It is not paid for by insurance, and any age can take it, including your age.
Okay.
And again, it's not a quick fix. It's just like the GLPs that, yes, it does help with satiety. It does help with
Time.
metabolic, but you do still want to do the other things. And it is almost, some of the statistics for it is very close to a GLP injection.
I never knew that. No, but
Yeah.
do you carry that product at
We
your,
do. We
I thought
carry it.
I
I know
saw
you have
that.
to be a
Yes.
licensed professional to carry it, and it only
Okay.
just got in the United States within the last few months. I could not find it here.
Oh,
That's why I
oh,
was traveling over there. I got it. I went on it myself for 6 months. I wanted to see, did I have any
yes.
digestive issues? All my family are morbidly obese. I have to work really hard, even as a dietitian and health professional, to stay healthy. So I
Okay.
wanted to see, did it make any difference? It absolutely helped me. Again, I noticed the biggest thing, I didn't think about food as much, which
Okay.
is really helpful. And again, I became a dietitian for a reason. I love health. I love to talk about food, make food,
Yeah.
read about food, and so
Yeah.
again, I have to be careful that I balance my thought process around food as fuel and tradition, and we don't, hopefully just use it for reward and different things, that we really do
Yes.
use it to fuel our bodies properly. So I think
Awesome.
that's something that's really helpful to know too.
I
Yeah.
appreciate that. Now, we don't have a whole lot of time left,
Okay.
but we've got about 5 or 10 minutes. I would like
Okay.
you to talk more about your company,
Oh, well,
what you
thank
can do
you.
for people, and how they
Okay.
can reach you.
Sure. Well, thank you, Yvonne. That's very sweet. So, I've been in private practice for 20 years. I've done this for 30 years, so I'm extremely passionate. I have a clinician named Kent, my stepson, who
Oh,
also,
yes. I
yeah, and
see
he has
him
a
on your
master's
newsletters.
degree. Yep, and he used to be a personal trainer and a master's degree from Denmark and an undergraduate degree at Florida State. So he's very into nutrition and health and neurotransmitters and mental health. And so both of us are the clinicians here. And basically, you have a lot of choices. If you have any issue, let's just pretend you just say, maybe it's not weight. Maybe you say, you know what? I wake up 5 times at night. I don't want to take a sleep medication. I don't know what's wrong. What could I do? And so we say, okay, well, you have two choices. One, you could go right to our website, nutritionconnectionbalance.com. Right at the
Mhm.
top, there's 15 free minute consultation. You could just click on that. You make an appointment. Within 1 to 3 days, you have an appointment with Kent. He would hear what you have to say and say, oh, well, these are 3 or 4 choices. You could try this supplement. We could do this test, or you could actually become more of a thorough patient, and then you would fill out a whole intake form. Then we would go to the next step, but that's free. If,
The
yeah.
first step, 15-minute consult with Kent is free.
It's really wonderful because even if decide, well, maybe I want to just try this, that, maybe he asks you questions that, well, are you waking up because you're urinating at night, or are you waking up because you just wake up and you don't know what's wrong? you know and even like that, sometimes if it's something simple, he might have a recommendation that's super simple. And if it's something like around hormones, that's the only area where he's not a specialist in, and I am, from running a
And you
company
are,
pharmacy.
yes.
He makes sure he gets to me, and then I make sure I talk to that patient, because then we make sure if they do need hormone help around female or male sex hormones. He knows about metabolic issues, cholesterol and insulin and hemoglobin A1C, but something very specialized, then I'd be involved. So you can go to our website and have a free 15-minute consult. If you're someone that is not very techy, you can call us at 850-227-7931. Heidi, my office manager, or one of our other employees and staff would help you. They could then help you know what you might need, get us on the phone, or she can also say, I'm going to talk to Valerie and Kent. If again, you don't want a free 15-minute, you just tell me a few things that you're concerned about, and they could write up what would be your next good step.
Recommendations,
Yes,
suggested recommendations.
that's
Yes.
correct. So it just
Now,
depends what people need.
exactly, based
Yes.
on your analysis. I'm assuming none of this is covered by
No,
insurance,
none by insurance. Now,
none
some
of the
people that do
tests or
have an
anything.
FSA account or health savings account and you have a credit card, you can use that because we are
Okay,
licensed professionals. So a
good
lot
to
of
know.
people do use that. Yep. So like for their
Okay.
testing, so let's say that you have high triglycerides. That's the fat that floats around in the blood that when you have a lipid test. So maybe
Mhm.
your cholesterol is being taken care of, but your triglycerides are high. Well, you could say, well, I need to know what to do. Well, we would say you want to do an omega test. And that runs about $200. That includes the test, the result, the clinical recommendations, and you
Okay,
get a copy of all the results, and you get a free medical portal so you can read it all and understand,
nice.
and you get a video and handouts. And then we make a clinical recommendation. If there's food things and or supplements, then we say exactly what to do, how to do it, and also how much it costs. So we're
Perfect.
very, very specific, whether it's
Very
prevention.
transparent. That's
Yes,
what I
yes.
like about it as
It's
well.
super important. Yeah.
Yes. Now, before I forget, you're
Yeah.
originally from Cleveland?
I am. I went to
Yes.
Cloverleaf High School. Yes,
Okay.
my sisters and my mom, my dad's passed away, but they're all still in the Lodi Creston area. I grew up in Seville, Ohio,
Oh,
near
okay.
Westfield Center.
Okay.
And then I moved to Florida when I was 17. I love nice weather. Lived there for
Mhm.
years. Then end up being back in, I actually was going to go to Denver to do my medical internship, but
Oh,
I decided I wanted to do the Cleveland Clinic because I could see my family and work with the Cleveland Browns, and Bill Belichick was there at the
yes.
time. So I got
Yes.
to work with Bill Belichick, the Cleveland Browns, and be near my family
Nice.
during my medical
Oh my
internship.
gosh.
So that
That's
was
the
wonderful.
ideal
Yeah,
lifestyle. So
yeah,
you're in Florida. Now,
I
obviously
am.
you have some local people that can come to you, but those of us who
Yes.
are out of state, and by the way, I'm
Yep.
currently in South Carolina. I'm
Okay.
living
Okay.
with my sister here in South Carolina,
Okay.
but I'm
Lovely.
from Ohio. I'm originally
Yes.
from Pittsburgh, but was living in
Yes. Yeah.
so I get blood work every 6 months,
Uh-huh.
mostly because of my cholesterol, and it's
Sure.
gone down a little bit. I'm
Yeah.
not so concerned about it. My doctor is the new doctor I have she's a naturopath. She's
Uh-huh.
what do you call it? Holistic MD.
Okay. Uh-huh.
And she's like, no shots, no flu shots, no
Yeah.
COVID shots. No.
Yeah. Yeah. Okay. Yeah.
She's cute. She took me off the
Yeah.
atorvastatin,
Uh-huh.
and I had used it before, but now I'm back on reduced
Sure.
rice.
Sure.
So
Okay.
I prefer to use as
Yeah.
much
Yeah.
natural stuff as I can.
We do in our office too. And certainly with my pharmacy background, if I think, we see that something natural isn't working or there is a big risk where natural and diet isn't working, then we say this is an option, and that type of thing. But I'd say 95% of our patients prefer the food and the natural route. And when I say natural, it isn't you go pick something off a shelf. We're testing, we're talking, and we're making sure that it fits everything in your medical history so that there is safe, and we see if it's effective or not, because
Yes. You
that's
follow up. You
important.
follow
That's
up.
correct. That's correct. And
That's
it's
so
important.
important.
One of the things that most people don't know, Yvonne, is that herbs and all those types of things were what medicine was before we had labs.
That's
And
right.
so
That's
they
right.
work incredibly well, but 70 to 89% in Walmart, in Costco, and anywhere you go are not the quality, the part of the plant or the herb, and have contaminants. And so that's why you want to go through someone like myself or someone like your doctor, that we know everything in my office is tested for over 200 contaminants. We know that if it doesn't work, it's not that there's something wrong, it's the right part, the right plant, but it doesn't work
Yes.
for you.
Yes. Yeah.
So very important. And when you bring up heart health, I think it's wonderful. That's where, like, even there, we're big educators. We do at least 4 free, well, they're going to cost this year, but 4 big lectures a year. And like
I saw
last year,
that. Yeah.
one of them we did last year was on heart health. And even there, people don't know what other questions to ask their doctor. Like, you could do
Yes.
red yeast or rice, or do you have a risk factor? Do you really know? It's not
Mhm.
just cholesterol, it's your lipid sizes. So
Yeah.
we make sure that we do a lot of free education. We do have a Facebook, an Instagram, and a YouTube. All that's free. All Nutrition Connection Balance, that you can learn, and you're getting correct, accurate, evidence-based information, so that whether you come to us or someone else, at least you can ask good, educated questions.
And you are one of the most knowledgeable people I have ever talked
Oh,
to, including
thank
even my
you.
doctor.
Oh, thank you. I
Yeah.
love the work I've done. And just, I've worked with so
Yeah.
many thousands of patients. It's amazing.
Yeah.
And I'm always going to continue in education. I'm always putting together lectures, and you have to do research for that. You have to
Yes.
make sure you're up to date, because that's what I love about my profession. People get irritated. Well, this used to be good, now it's not. I'm like, yeah, but that's why I love it. It's based on science.
Exactly. So it changes, and that's
Yes,
okay. My favorite saying
yes.
is the only thing that's permanent is change.
There you go. And we're miracles. We're walking miracles.
Yes.
I mean,
Yes.
we're
Yes.
so lucky to get to love and educate people. And also, I think we just don't realize that we do put things in our body that isn't healthy sometimes. And it's amazing how well it still works. We just got
It's
to up
true.
our
When I
ante.
think about the way I eat, but I fairly well, but I'm a sweet
Yeah.
eater. That's my
Yeah.
downside. And
Yeah.
I know I'm
Yeah.
feeding that candida or whatever's in my
There you
system.
go.
And it
Yes.
is
Your
craving
guts.
sweets for
Yes.
sure.
Yes.
Val,
Yeah.
please tell my audience
Uh-huh.
once again
Okay.
where they can reach you, how they can
Sure.
connect with you, and how they can sign up for your newsletter, because I've been enjoying your newsletter.
Oh, sure.
So
Yeah.
go
So
ahead.
all of that. Yeah. Thank you again, Yvonne. So
Mhm.
Nutrition Connection Balance. Our website is www.nutritionconnectionbalance.com. You can call our office if you have any trouble on our website. You can get on our newsletter. If you have any trouble with that, you could also call our office 850-227-7931. Our office manager will make sure you get on our newsletter. And of course,
Okay.
we can answer any other questions. We also have an email, ncbteam@nutritionconnectionbalance.com. So any of those ways you can connect with us. We hope to hear from you. We'd love to take care of you and up your game and just make you as vibrant and as excited as we are, Yvonne, about health and life, you know?
Amen. I cannot thank you enough for your time because I know
Of
how busy you are.
course.
You're
I know. Well,
pretty good.
that's all
I'm on
right.
your Facebook page. I see you're going all over the world.
Yes, I travel, and anywhere I travel, I give speeches. So even that, I just love it. Yeah, it's so
That's
fun.
awesome because you're so good at it.
Thank
Valerie,
you. Of
thank you again for being my guest today. Valerie Sayre from
course.
Nutrition Connection Balance. You can go to her website as she just shared with you, and you can talk to her people directly. You can order products from her. You can get testing done through her. And I'm actually considering doing some of these tests as well. So thank you all for watching today. Have a blessed day and have a happy holidays. This is
Oh my
Christmas
gosh.
time.
It is. Happy holidays, everybody. Bye-bye.
Now, bye bye.
Take care.